KLIF News and Information time is now 7:50. Well, Tony Romo didn't need a doctor to tell him he broke his left collarbone again. He did it back in 2010, and he felt the same thing he felt back then. And he knew.
Dr. James Pinckney is an emergency room doctor at Methodist Addison, and he is joining us now to talk about Tony Romo's injury and maybe get an idea of how long it might take for him to recover and what that depends upon. Dr. Pinckney, good morning.
Hey, good morning.
Were you watching the game? Just a matter of curiosity.
I was, and my heart sank when I saw the play. You know, his left shoulder was driven into the turf with a lot of force, and if you could read his lips when he was coming off the field, he said, "It's broken."
Yeah, that's what that sideline reporter told everybody. I didn't notice that when he said it, but I felt the same way when I saw him go to the ground, and then that guy landed on top of him, and boy, what a crushing blow that was to his left shoulder, and just hoping it was the shoulder that was knocked out of joint or something. But now we know better. It was a clavicle, and they said it was. I guess they said it was you tell me, what was the description, and what is your view of it?
Well, I'm not sure if it's a mid-shaft clavicle fracture or more closer to the rib cage or to the shoulder blade, but typically it's mid-shaft, and those injuries take about 6 weeks to heal. Now, here's the issue. He had the exact same injury in 2010. So the question is, are the orthopedic surgeons going to place a plate and some screws to kind of reinforce that bone? And we won't know that for a few days.
I was just going to ask you that because it seems it happened once and it's happened again. And what's to say it couldn't happen a third time? Do they need to shore that up, like you said, with some sort of surgery?
Right, and oftentimes they will. Rob Gronkowski had a forearm fracture twice, and I think after the second time, they went ahead and put some plates and some screws in there to reinforce that area.
So if there is some sort of surgical procedure that needs to be done, would that likely increase the length of time for him to recover and get back on the field?
Yeah, it would. It would most likely increase the length of time, but you're thinking long-term, and if that's the best thing to do long-term, then I think that's the direction the orthopedic surgeons should take.
And is this a pretty simple surgery to do that type of thing?
More or less in the surgery orthopedic world. It's not too complex, but again, it's dependent on where exactly that fracture is. Now, I'm sure he'll either have more x-rays today or possibly an MRI to assess the extent of the injury.
Yeah. After the game, Cowboys coach Jason Garrett said, we have to determine how much muscle damage there is in the shoulder, and then we'll have a better idea in the length of time that he'll miss. I don't think most of us gave that any thought. Is that really part of the consideration?
Yeah, absolutely. He could have a rotator cuff injury. There's cartilage within the shoulder joint, the labrum, the glenohumeral ligament. There's all types of ligaments that are holding that shoulder joint in place that could have also been damaged during that tackle.
We're talking to Dr. James Pinckney. He is an emergency room doctor at Methodist Addison. Do you think he could have damaged his back at all, which he already had problems with?
It didn't look like when he was walking off the field that he was having some back pain, but of course, when you have a blow with that type of force, the back could have been injured, but that's probably unlikely at this point. I haven't heard anything about a possible back injury or back exacerbation.
I suppose as fans, if we're going to look for a silver lining here, was that it occurred on his left side and not the side that throws the football.
Right. That's a huge point. And although he has had an injury on that left side before, it seems like the right shoulder, his throwing shoulder, is okay and intact, and he should be able to make a full recovery.
How about Des Bryant? It seems like his recovery is going to take longer than first anticipated.
Yeah, I think they had to put a screw in his foot as well, that foot fracture. And again, when you start putting hardware in the bones, it takes a little bit longer to heal. So, we wish Des and Tony the best, and we hope they have a speedy recovery.
Well, certainly. And I was going to ask you if professional athletes recover from this sort of thing faster than the rest of us would. At the same time, they certainly have much more damage inflicted upon them on a regular basis.
That's a good point. They actually do heal a little bit faster than the general public. They are really into nutrition, physical therapy, top-notch. They're training every day and receiving treatment on injuries every day. That does expedite the healing process.
All right. Well, we thank you for your expertise
Thank you,
this morning,
Doctor.
Dr. James Pickney, an ER doctor at Methodist Addison.